Well, 9-year-old Rodwell Nkomazana's face is being fixed one surgery at a time. Doctors performed the first of many major reconstructive surgeries yesterday. The young boy from Zimbabwe was mauled by a hyena while sleeping at a church gathering in Harare last month. The animal bit off part of his face. Well, renowned Dr. Ridwan Mia is leading the operation, a pro bono. Dr. Mia joining us now to tell us how it all went yesterday. Dr. Mia, good afternoon and thanks so much for your time. So how did yesterday's surgery go? It was the first major surgery performed on Rodwell.
Good afternoon. Yes, it took quite a few hours. I think we were in theatre for about 5 hours altogether. We managed to reconstruct the left upper cheek area as well as the orbit. That's the bony housing of the orbit of the eye. And we inserted a silicone ball into the left eye or into the left orbit, which will be a base for a prosthetic eye in time to come, so a shield that will mimic the right eye. And we also managed to stabilize a lot of the other wounds and scars on his face. So we did what's called a forehead rotation flap to close off some of the defect which he had on his forehead on the left side. And we managed to ascertain where all the vessels are and so on in anticipation of, I think, at least 2 big surgeries which are to follow, and then a couple of small ones. Overall, Rodwell's doing well. He's in ICU. We've got him quite sedated for today as he's recovering. But the surgery went well, and yesterday's surgery was mostly directed by Dr. Jamil Desai, the maxillofacial surgeon, and I think he was pleased overall with the way things went.
So you say you have him sedated, he's doing okay. Can you give us a little bit more about his condition at the moment, Doc? I mean, when he wakes up, what will he be able to do? How will he be able to function? Could he eat? Is he still covered in bandages?
So he's got not full bandages, but he's got dressings over the middle part of his face, which is the part that's waiting for reconstruction. That's the nose and the upper lip primarily, and part of the forehead. But he has a tracheostomy tube in his neck, and as well as a tube that goes into the abdominal wall directly into his stomach. And that's the way he's being fed at the moment. So he won't be feeding orally at the moment, or breathing through the nose or mouth. It's all done through a tube. Prior to the surgery, he had those tubes in, and he was in good spirits, watching TV, playing with his iPad, still trying to talk past the tracheostomy tube, which I think he's getting right, actually. I think as he wakes up, I don't think he's going to be very difficult. For a child of 9 years old, I must say he's quite mature, and he's handled it well so far. So I anticipate that he's going to do a good job.
I gather that from what you said, but we just wanted to gauge what his emotional state is at the moment. Like you say, he seems to be in good spirits, but from what you see, surgery is such a serious thing, and knowing the damage that has been done to his face. He's 9, but I'm sure he's well aware. Just emotionally, what's the support out there for him?
So we have a psychologist who's seeing Rodwell. The sessions haven't been officially started as yet, but I think there's been some introductions. So hopefully that will help him come through these procedures. I think the actual trauma and the surgery, not the surgery, but the treatment he had in Zimbabwe were all pretty grueling. But having said that, it almost prepared him for what's to come. And he's comfortable. He's actually in a good mood. He's jovial, and tries to make some jokes, and he's got a good laugh, and tries to root everybody in on his jokes, and giving high fives and so on. So relatively speaking, he's in a good place. I think he's very comfortable with his room, and seems reasonably happy with the toys that our nursing staff and some of the doctors have contributed as well. So, his mum's around as well, and I think he's taking comfort from having her sort of in and out of his room and nearby, which helps a lot as well. We also have psychological therapy happening for his mum, which she's quite appreciative of as well.
Well, Doc, it's probably too early to say. Like you say, he's got a couple more major surgeries to go. But how close to his old self, to his previous sort of the way he looked, would he get after all of these surgeries?
Unfortunately, Rodwell is always going to look very different. Having to reconstruct that whole middle part of the face, unfortunately means a fair bit of scarring And, unfortunately, he won't look very much like he used to look. The basic frame of his face will still be the same, of course, but his nose and mouth will have changed in shape, and the proportions will be different as well. We obviously prioritize functionality over the cosmesis, but we do aim to give him as recognizable a face as possible. But unfortunately, he will always have some degree of scarring, and it will be obvious that he's been reconstructed.